Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kiner Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is time for part 8 on ambulatory glucose monitoring, so I hope you enjoy it. These talks are part of our efforts on health promotion, focusing on diabetes prevention and early detection, so you can become a healthier version of your previous self. As mentioned before, we have this fitness and weight management program, ARIS, for the Greek god of war, so you can start your battle against sugar and start losing weight. Destined to younger, more active, and overweight people that want to acquire a better diet and a better fitness program. But we also have Janus, our healthy lifestyle and weight management program. Janus was the Greek god of new choices, new beginnings. So you can start a new lifestyle that can lead you to a longer, fuller, and happier life. This program is destined to more health-conscious people that are overweight or obese, that maybe are a little bit older, or have already risk factors for metabolic chronic diseases, or prediabetes, or even diabetes, and want to stop the development of one of these diseases, the progression of their disease, and the development of complications, to eventually be able to live a longer life and be able to fulfill all their dreams with their loved ones. So, indeed, to become a healthier version of their previous self. If you're interested, please call this number. Before starting with the talk proper, I'm going to mention that in the previous talks we used the term of sugar because it's more commonly used. But we're going to use from now on the medical term of glucose because the technologies we're going to discuss in the next videos have the name of glucose in their name, so it will be simpler for you to understand them. Let's talk first about self-blood glucose monitoring, the so-called finger pricks. Many people is familiar with them. The patient uses a lancet to pinprick the finger, then a drop of blood comes out. With the strip of the reader, the blood is obtained into the strip, and then the reader gives you a number, a level of glucose for your monitoring or for change your therapy, etc. As mentioned, it's a traditional method, so many people is familiar with it, so that's a good point. But it's cumbersome, as I explained, involves finger pricking. You might need to do it in a clean space, so finding a clean space is a little bit difficult sometimes. It's painful, and it's not discreet. Maybe you want your own privacy, so it requires a little bit of, work. You need to clean the finger, you need to do the pinprick, then you need to press on the finger, put a plaster. So some people want their own privacy while doing this. But as a tool, it's cheaper than the other technology, the one for ambulatory glucose monitoring. But that can prove to actually be more expensive in the future for many patients, especially if the sugar control is not that great, because they can miss some points where the sugar goes high or the sugar goes low when they just do the readings at certain time points during the day. And that can impact health because it means that your high levels can be unnoticed, and the persistent blood sugar can lead to complications, for example. Let's talk now about flash continuous ambulatory glucose monitoring. Let's define that. Flash, because instead of fingerprint, you just use a reader, or in some countries a mobile, to flash over the sensor and get the reading. Just beep, and then you get your reading as you can see on the screen. It's continuous because you don't measure just the sugar when you do the pinprick like in the other technology. You can measure it anytime, and the sensor is measuring continuously. Even you are not flashing the system, it's measuring continuously your sugar. while you're walking, while you're sleeping. And it's ambulatory because you are very mobile, you do it by yourself, you do it at home, in the office. So therefore, it's more convenient than the finger pricks. Some patients even now prefer to use this method than finger pricks because of that. But what is more important, it gives you real-time readings. You can be eating after 30 minutes, 1 hour, 2 hours, after a snack, after exercise. As soon as you go to bed or wake up, you can just flash it with no really strong effort or pain. But also importantly, can give you continuous data, as mentioned before. The sensor is measuring your sugar all the time throughout the whole day while the sensor is in place. It's more discreet and give you mobility. As I mentioned, measures the sugar when you're sleeping, but also to get this continuous data, you need to flash regularly the system. You cannot do it for more than 8 hours apart, otherwise you miss some data, but you can do it when you wake up, at least, when you go to bed, and 2 times in between. But if you want to see how you respond to certain meals or activities, you can flash more often, or you're keeping a record, etc. But the minimum is those 4 kind of times during the day, so you don't miss those 8-hour time points and you get the complete data. Compared to the other technology, is indeed more expensive when you take into account the device plus the sensors, in comparison to the other one, the device plus the lancets and the strips. But as alluded before, it can prove to be an investment in your health, because you will get more data out of it, continuous data that you can utilize to improve your diet, your medications, your insulin regimen, your lifestyle, etc. And therefore, in the future, improve your outcomes. One of the problems is that many patients, doctors, and caregivers are not very familiar with this technology. Therefore, all the potential is underutilized, especially if they just use him for the flashing, like you just get the reader, because the system gives you a lot of statistics that you can apply for a better care of the patient, as you will see in 2 videos later. So, one of the questions that you can think now is, should you change from finger pricks to continuous monitoring? To answer that correctly, you need to consult your doctor. You can consult me as well. And maybe you will need to watch the next 2 videos. But I will just summarize what is basically the answer in the next slide and by this statement. Basically, the answer is, it depends. If convenience is your priority, because you want discretion, you want to avoid pain, you want better mobility, maybe you should change. If performance is your priority, so to get better glucose monitoring and therefore more accurate doctor advice on your medications and diet, maybe you should change. But not every patient needs really to change into this system, especially if the diabetes is stable, as defined as good glucose control and other metabolic parameters, especially if it's on diet, on oral medications, that everything is okay, no? Or could be even on insulin with, small doses of insulin, because the patient take good care of themselves, the meals are fixed and healthy meals, so like the diabetes is eventually well controlled. So probably you don't need to invest in this system. Having said that, I still believe, is my personal opinion, that many, if not most patients, still will benefit for at least get one reference or baseline profile. Because maybe everything looks okay, looks in order as the previous measurements like HbA1c or your fasting glucose, but sometimes you can identify some points in which the sugar can go higher or lower, and then you can do a little change for a better improvement. Because even if the sugar, let's say, is only high at dinner time, it's going to be high for the next day, the following month, 6 months, 2 years, etc. So you can do a little change for a little improvement that can have a very significant impact in the future, maybe allowing you to prevent a complication. So I still believe that still most patients should get a reference profile, but also if everything looks okay, so you have the confidence that continuing with your previous regimen or your previous method of monitoring, that could be the finger pricks, is sufficient for you to get a good glucose monitoring. But if not, you can maybe discover that this is your new method, a better method for you, or you can implement changes that can change your future outcomes. Just want to comment about the importance of keeping a glucose and diet record, that you can also add a record of your medications, your insulin, exercise, irrespective of the method of monitoring you use. So if you keep these records and you can relate it to food, to activities, you and your doctor can make more sense of all your sugar readings and therefore implement better changes in your management. So I hope you enjoyed this video. Please share these videos, give us thumbs up. Maybe it's useful for you. If not, might be useful for some of your friends or your relatives that maybe are overweight and want to lose weight, or have prediabetes or have diabetes and want to improve their control or their management, want to prevent complications. So the next video will be on Freestyle Libre. That is the most widely available system for ambulatory glucose monitoring in Singapore, and that I have available at my center. So please stay tuned for it. Thank you very much for your attention. Take care.